Welcome back. I am enjoying my discussion already with our next guest. Preventative care for your teeth and how that can help improve your overall health. Here from Hudec Dental, and a welcome to Cleveland is Dr. Arjang Garamifard. Thank you so much for being here today. Did I do okay with the name?
Yes, absolutely perfect.
Welcome. How long ago did you move to Cleveland?
It's about very recent. It's about 2 months now. We just moved from Michigan.
Well, we are so happy to have you here.
Thank
we need more nice dentists in our lives, I feel like. And you know, I feel like as we get older sometimes, as kids, parents are always making sure that their kids go to the dentist every 6 months or whatever the regulations are. As adults, sometimes we skip things. We know we'll get to it, and then we forget and we push it off. Sometimes years people go without going to a dentist.
Correct.
But that is absolutely probably the worst thing someone can do.
Yes.
Why is dental health so important? It affects more than just our mouth.
Your mouth basically is just another part of your body and needs checkup, and you'll be amazed how it's related to the rest of your bodies. Sometimes you get a dental checkup and you'll realize like, oh, you can prevent it from having a stroke sometimes, or even like being undiagnosed with diabetes, because the bone level is very, very related to if you're having diabetes or not.
Is that, what is it, how can you tell about a stroke in advance?
So one of the cases that I actually experienced myself was, I had a patient that came in with a panoramic, and then we saw like basically a big calcification around the neck. And I asked the patient like if you had any basically check up with your doctor about your heart, and he said no, but I'm planning on to it. So we ended up actually give a referral, send the patient immediately. I told him that your dental checkup can wait. You need to go immediately check with a cardiologist. And he ended up actually being on blood thinners now.
Wow. I mean, you quite possibly saved his life. I mean, that's
yeah,
absolutely
it was very rewarding feeling.
I'm sure it was. And cancer's another one that somehow
yes.
you can catch. Is it just oral cancer that you can catch through screenings, or?
That's a very good question. So sometimes it's like specifically oral lesions that is like called oral cancer, but sometimes you see like lesions that is related to the rest of the body. But specifically for oral cancer, I want to bring this up. Like one of the most common one is called squamous cell carcinoma. For the simplicity's sake, let's just call it SCC. That is the second most common skin cancer that you see among your patients, especially when you get dental checkup, and it can easily be avoided and prevented, not smoking.
What? So I would think that's something you find on your skin, but through an oral exam, you can also, can it also develop in your mouth then too?
Yes.
I don't think I realized that. Okay.
Yes, sometimes like a lot of times like people do not know because you don't have any pain, so it's very silent and quiet, unless like a dentist can actually take a look at it.
And I'm glad you bring that up, because normally as you get older, one of the main reasons you go to the dentist is because there's pain. But even if there's not pain, that doesn't mean there's something that could be an issue that's underlying. What do you recommend as far as people coming in on a regular basis? How often should they be coming to just at least get cleanings?
So definitely annual checkup is very important, and once you get the treatment plan, if everything is good and healthy, recommendation is to get every 6 months cleaning. And during the cleaning, actually, we at Hudec Dental, we actually do another examination. And for example, when you come in for a checkup and we have like some watch lists, we call them like watch lists, and then when you come back for cleaning, we reevaluate those teeth to make sure everything is fine and you don't need like any complications needed to be treated. So basically, your dental checkup can save you a lot of time and going through like complicated situation. When you have tooth pain, it's likely the size of the cavity on your tooth is very big. Sometimes people come in and they don't know that they have actually an abscess in their mouth. And like sometimes the last thing I myself want to do in my career is to pull a teeth out, because you basically lost so many chances to save it.
Well, I mean, it saves you time. He can save your life. I mean, think about it. That is such a big deal, what you've addressed earlier, too. So thank you so much for coming in today. Which location are you at for Hudec Dental?
I practice in the Memphis office.
At the Memphis office? So keep that in mind if you want to go specifically with him. Thank you so much, and welcome again to Cleveland.
Thank you.